Hello and welcome to MMI Monthly, a podcast sharing public health stories from bench to breakthrough. I'm Thomas Locke. When COVID-19 first emerged in late 2019, it wasn't just a novel virus. It was a global test of how we understand, study, and respond to infectious diseases. For researchers working on respiratory viruses, it marked both a continuation of decades of work and an urgent shift in focus, because respiratory viruses like influenza and RSV have been with us for generations. The tools to fight them, vaccines, hygiene and staying home when sick, are familiar. But SARS-CoV-2 rewrote the rules on speed, scale and global coordination. So what did we learn? What's changed? And what still lies ahead? Well, joining me to discuss this is Professor Andy Pekosz, a virologist at Johns Hopkins University, whose research focuses on influenza, SARS-CoV-2 and other respiratory viruses. He's a professor at the Department of Molecular Microbiology and Immunology and co-director of the Johns Hopkins Center of Excellence in Influenza Research and Response. Dr. Pekosz, thanks for joining me. To take your mind back to the start of COVID-19, and as someone who spent their career studying respiratory viruses, how was working on COVID-19 different from or similar to your work on other viruses?
Well, first and foremost, it was much more serious. With working with respiratory viruses like influenza, we always have what we call population immunity, which is everybody has some level of immunity, and that dampens the disease we see from most respiratory virus infections. With COVID-19, we had no population immunity. Everyone was susceptible, and therefore we knew there would be a larger number of deaths that are coming from infection. And so your work really, you change the perspective that you have on your work when you realize that some of the work that you're doing has the potential to really directly save lives. And I guess that also impacts how quickly you need to do the work. Sometimes as scientists, particularly academic scientists, we take our time, we do the right experiments, we do the controlled experiments, we reproduce things. With the COVID-19 pandemic, we really had to start generating data and putting it out there as quickly as possible, and then hoping that we can, verify things quickly as well, too, to make sure that what we were saying was accurate. So everything was sort of on steroids, sort of moving at light speed as opposed to what we're normally used to.
During the pandemic, you were often called upon to explain the science to the public on radio and TV interviews, as well as webcasts from Johns Hopkins. What lessons have you learnt about communicating science to the public, particularly at times of uncertainty?
Well, I think it's really important when communicating to the general public that you're clear about areas where we have strong evidence for. You're clear about the areas where we have pretty good inferences or support for those areas. And of course, the areas where we have no answers for. I think we had a lot of examples of how we could deal with a respiratory virus infection from previous work with flu and prior flu pandemics. But there were so many specific things about SARS-CoV-2 that we didn't know. And again, communicating that level of certainty that you had with your results and what it was that you were basing those results on was really, I think, the biggest challenge. I think you also want to make sure that you strike a nice note in terms of you want to make sure that the message is simple, but you also don't want to make the message too simple so that people think that you're sort of preaching or teaching or talking down to them in any way. I found that to be a nice challenge. I really feel like communication is such an important part of my job as a virologist and as a professor. And, the pandemic really sort of put that to the test, but gave me an awful lot of experience in terms of how to do that communication in effective ways.
More broadly, I wonder in what ways you think COVID-19 has changed the scientific landscape, both in terms of funding for science, but also public trust.
Well, science always works on scientific principles. And science, though, has now sort of gotten drawn into the world of politics, and science is being somewhat used as a political tool. I think that's something that many scientists were not prepared for. For many years, there was bipartisan support for all aspects of basic science research, but particularly for infectious diseases work. I think the weaponization of some of the things with science really became something that many scientists didn't know how to respond to. And it's something that we also are currently trying to deal with. Scientific principles are very different from the principles that are used to sort of convince people of things from a political standpoint. So it's also, I should say, very easy to scare people as opposed to reassure people. And so oftentimes that rhetoric, when it's particularly negative, can be much more powerful because it is negative, and that resonates with people more than some of the more reassuring messages that scientists had, particularly towards the end of the pandemic.
I suppose much of the public health guidance around respiratory viruses, like getting vaccinated, staying home when sick, and practicing good hygiene, has remained consistent for decades. Do you think this familiarity makes it harder or easier for people to take on board those messages?
Oh, it makes it much harder. In many of my lectures, I tell my students that influenza-like illness is one of the most overused terms in the medical dictionary. And what that does is it breeds sort of familiarity with it. People hear the word influenza and they think about things ranging from the common cold to severe respiratory infections. And oftentimes differentiating between those different viruses that cause those different diseases can be challenging because the symptoms are so much the same. But yet those are critical differentiations, particularly for certain age groups or people with certain medical conditions, because there are certain groups that suffer the most from particular kinds of respiratory infections. So you have this general feeling like everybody knows what influenza is because I'm sure I had it last year. And in fact, many people haven't had it last year. They had another respiratory infection, and they're just sort of mixing the two things together. And so having that clarity, again, for the vast majority of people, maybe it doesn't matter too much, but for those people who are more susceptible to severe disease, it really makes a big difference.
You're the co-director of the Johns Hopkins Center of Excellence in Influenza Research and Response. Could you tell me more about some of its aims and purpose?
Yeah, so JHCER is an institute that we established here at Johns Hopkins. It's funded through NIH support. Really, we were aimed at focusing our work on understanding seasonal influenza infection as well as other respiratory viruses. And what we try to do is put a pipeline of investigators together so that we can learn more about why seasonal respiratory viruses circulate, try to find ways to intervene in terms of lessening disease severity or disease case numbers, and also tie together multiple different disciplines and try to bring them together to ask a more sort of holistic question about influenza and other respiratory viruses. So we've been trying to do exactly that, linking multiple investigators together, some investigators who have some experience in influenza, others who are new to the field. And through that combination of new techniques, new investigators, old problems, we're trying to really be much more efficient and clear about our responses to seasonal influenza. And then, of course, that plays into our responses for the eventual pandemics like it did with COVID-19.
Could you tell me more about the lab you lead, the Pekosz lab at Johns Hopkins?
So really, my lab is about understanding how seasonal respiratory viruses change from year to year that allows them to infect not only people who haven't been sick recently, but also people who have been sick recently. A lot of the work that my lab is working on now shows that, one thing that respiratory viruses do is they escape population immunity, but oftentimes that happens at what we call a fitness cost, meaning that the virus escapes, let's say, an antibody binding, but the virus then starts to replicate a little less effectively. And then somewhere down the line, the virus picks up mutations that allow it to replicate well again, and it's that virus that ends up causing the disease in the population. So we're really trying to understand, I would say, basic Darwinian natural selection principles. What is it about a virus that can allow it to infect a person, and how does a virus change in terms of being able to replicate at a very effective level so it can continue to transmit and find new hosts And it's much more complicated than just escaping vaccine-induced immunity. And I think that's where my lab really spends most of its time right now.
And what do you see as some of the biggest emerging threats in the world of respiratory viruses?
Well, one of the things that I worry that we're starting to do is to focus solely on the individuals who are at higher risk and forget about the fact that the rest of the population actually can contribute to the control of respiratory virus infections. Just because individuals between the ages of 20 and 45 don't suffer very severe influenza or COVID doesn't mean that they shouldn't go out and get vaccinated to help reduce the overall burden of disease in the population. And I think those messages are ones that were a little bit difficult now to communicate to the general public. We've just gone through the COVID vaccination process, and obviously now we're simplifying the COVID vaccination process in terms of only having it once a year. But there were times when we were asking people to come back twice a year for vaccines, and that was something that people didn't really understand. And probably one of the failures of our communication is to really effectively communicate why at that time multiple vaccinations for COVID-19 were needed. One of the other things that I think is really important about the COVID-19 vaccine response is we often think that the vaccines didn't work as well later in the COVID pandemic, where in fact, from my perspective, it's actually the opposite. The vaccines were still working well, but the virus had actually changed. And it was now a very different target for the vaccines. It was much more easier to transmit. It was causing very different symptoms. So all of those aspects of it sort of played into the public being unclear about the role of vaccination for COVID-19. And again, this is where I think communication could have been better improved. And it's something that I'm currently really just striving to do, is to maintain that ability to communicate the need and the effectiveness of these vaccines across different age groups.
And to take a step back, what initially drew you to virology and respiratory viruses in particular?
Well, as an undergraduate, I was working in a laboratory that was focused on a virus called yeast killer virus. It's a very sort of intimidating name, but really it was a virus that infected yeast cells. At times it could lay completely dormant, but under certain triggers, it would erupt and essentially kill millions of yeast cells over the course of several hours. And now, of course, that happened around the time that I got interested in beer, so maybe there was a connection there between viruses that killed yeast and beer. But more deeply, it was a virus that had very, very few genes, yet somehow was able to completely co-opt this cell and make it produce hundreds of thousands of virus particles against its will. And that understanding of how viruses have a way of really focusing in on some of the critical aspects of our cells' functions, of our body's functions, and manipulate those was what really fascinated me from a scientific aspect. I thought they were fantastic tools to gain better understanding of our cell biology, of our physiology, because so many viruses targeted so many different things and so effectively coverted our efforts to do normal physiology.
And finally, what advice would you give to someone interested in pursuing a career in virology or public health? What advice would you give them?
Oh, I think virology is such an interesting area. It allows you to do cell biology, microbiology, immunology. You can even get to levels of epidemiology and public health on a broader scale. So a virologist can be a jack of all trades, and it never fails to keep me interested because the viruses are always teaching us such new, novel, and intricate ways in which they're able to complete their virus life cycles. It's always a fun and interesting time working on viruses because you never know what to expect next, and you're always learning something new.
Perfect, thank you. Well, Dr. Pekosz, thank you for your time today, and join us next time on MMI Monthly for the latest science and ideas from the Johns Hopkins Bloomberg School of Public Health.